Today we will discuss breast augmentation or breast enlargement. In records of women's early efforts to enhance breasts, scientists found artifacts from ancient Egypt, Rome, and Greece. In fact, at that time, women used only natural remedies like bay oil and herbal infusions. Since there was no noticeable result from the procedures, they decided to cheat. So various pads and corsets appeared, which visually increased the bust. And as for the father of operative breast augmentation, perhaps we can mention the Italian surgeon Gasparo Tagliacozzi. In 1665, he developed a method of reconstructive surgery that allowed for breast augmentation. Thanks to this significant discovery, affluent ladies now have hope for a safe and effective outcome. Modern augmentation is not a feat anymore, but rather a common operation that assists millions of women in feeling beautiful and desired. Today I will try to answer the most common questions about breast augmentation. Subscribe to my channel. I will say right away, augmentation is the only way to increase the breast if a woman is dissatisfied with its size. There simply are no other alternatives. Well, more precisely, they exist, and if you pay attention to the main questions before you undergo surgery, you can minimize the risks of this operation. The first thing that worries women is the stitches that remain after the surgery and where they will be. It all depends on the method by which it will be conducted. There are at least 3 ways to install the implant. Periorbital access. The incision is made along the lower edge of the areola, at the border of the nipple areola complex and the skin. In my opinion, this is one of the most aesthetic methods among the benefits. If executed accurately and cautiously, they will be virtually imperceptible over time. One of the downsides I would say is that if, for example, an inexperienced or beginner surgeon performs the operation, there is a chance of damaging the gland, the mammary gland. The second access for breast augmentation is axillary access, or an incision under the armpit, which is located in the area of the armpit hollow and runs along the posterior edge of the border of the pectoralis major muscle. And this method is quite popular. Honestly, he seems the most traumatic to me, and access to each pocket where the implant is directly inserted is a bit far. Method choice is subjective. Each surgeon has their own arguments. Finally, the submersible access. This access is performed in the natural fold under the chest. In cases where the mammary gland and submammary fold are well formed and there is no need for displacement, the postoperative scar will be practically invisible. And remember, whatever method the doctor chooses, you must discuss all the pros and cons of this choice with your surgeon before the operation. The next question that a woman finds difficult to decide immediately is the shape of the breast she wants to have. But you have to make a decision, because the choice of implant depends on it. Implants come in different types. There are textured ones, smooth ones, anatomical shapes, round ones, and they also come in different profiles. All this is done to accomplish a specific task. Approach each patient individually. To date, we use 2 main forms of implants. This is an anatomical implant with an iliacopleviform shape that preserves the natural shape of the breast, and it is round and spherical. When choosing new breast sizes and shapes, be sure to consider the parameters of your body. Listen to the surgeon's advice, as he will be guided by many important factors. Your complexion, chest width, original size, features of the structure of the gland itself. Agree, a delicate and slender short girl with a small 5th size bust will appear somewhat unnatural. Moreover, it is simply impossible to physically place an implant of the 4th, 5th size to a girl with a small bust. This will need to be done gradually. First, let's try the 3rd size. She tried it on, then even bigger, and so step by step. And remember, ladies, that a breast with large implants will behave the same way as a regular breast. Therefore, it will also be influenced by gravity, resulting in its sagging. Wear supportive underwear, avoid weight fluctuations. When choosing an implant, be very careful in choosing the manufacturer. It is better to choose manufacturers that provide a lifetime warranty for their implants. You should be wary of the too low cost of the operation. Before signing the contract, be sure to inquire about which implants will be used. Sometimes when releasing new models, manufacturing companies sell them at an attractive price due to the lack of sufficient clinical trials. And that's exactly what happened with BioCell textured implants from Allergan, which in 2019 were recalled by the US Food and Drug Administration, FDA, on the recommendation of the Office of Sanitary Supervision of Quality of Food Procedures and Medicines, as a link was found between the development of lymphoma and textured implants from this company. Statistics showed that about 91% of lymphoma cases were associated with implants of a specific brand. Experienced experts work solely with established brands. It's a broad selection of implants that offer doctors the option to choose. And here each surgeon selects for himself. In my practice, I solely collaborate with verified companies that have already established themselves in this market, for instance, Mentor or Motiva. In plastic surgery, all decisions should be made very individually. Therefore, if you also need competent advice, follow the link below this video. In conclusion, I will try to answer the questions you ask me in private messages. They can be divided into several topics. First, can you breastfeed your baby after breast augmentation? I'm answering, yes. Implants do not impact the process of milk formation. Hence, a woman can breastfeed her baby freely. The key is to remember that pregnancy and lactation impact the shape and size of the breasts. Therefore, personally, I advise you to give birth first and then think about the operation, to avoid touching the hardware so that there are no mastitis or other complications after surgical interventions. After all, the chest is an organ that produces hormones and performs a specific function in the body of a woman. Question number 2. What will be the recovery period after breast augmentation surgery? The duration of the rehab period depends on the individual characteristics of the body. Usually, the recovery process takes from a few weeks to a month. Personally, I strongly advise you to strictly follow all doctors' recommendations and wear compression underwear for the first month. Naturally, no physical exertion for a month. Do not go to the bathhouse and sauna. Do not sunbathe. Be sure to wear supportive underwear. One more frequently asked question: how risky are implants for human life and health? Partially, I've already answered this. If the implant is viable, the risks of its impact on the body are practically zero. What does solvent mean? So, there are no breaks, changes, moments associated with destructive changes in the implant. But that doesn't mean you got it and forgot about your chest for 10-15 years. Under no circumstances, I strongly recommend undergoing a medical examination once a year and doing an ultrasound of at least the mammary glands. Why am I saying 10-15 years? Usually, this is when age-related changes are already happening. If everything is fine, the implant will last longer. Just the tissues around the implant continue to change and age. Therefore, be sure to take care of your health, and the results of the operation will delight you without any problems. You were with Dr. Maier. Take care of yourself and always choose the safest path to the desired beauty. If you have any questions, subscribe and ask them in the comments. I will be glad to answer.